Hello, everyone, and welcome back to healthcare.gov. So, we're logging in because we have just verified our account. So, everything is good there. And so now we want to go right here and we want to visit the marketplace for individual health plans. Follow this instruction. We want to apply for 2015. We're in Utah. Oh, we're going to remove this. Okay, we are going to apply for 2015. Right here on this page, you're going to hit the next button. A lot of the buttons, you're going to hit the green next and move forward very quickly if you have your stuff in there, okay? If you want to read this, you can. Otherwise, you just click agree and move forward. If you don't agree, you can't do it. So that makes it easy. So this is my client's home address. It's all the same, hasn't changed. And we have his phone number and email addresses in here. And so on this page, this is one of the most important pages right here. Help applying for coverage. Yes, we want you to be able to put this in. If you are having someone at Advanced Insurance help you, you need to put them as an agent or broker. So if you put in Tyler and Parcell right here in first and last name, our organizational name is Advanced Insurance, and then this is the important part, the FFM ID, Advanced Insurance, no spaces, and the national producer number is 152-87058. If you do not put this in, whoever is your agent cannot access your policy or help you work on your policy down the road or during the year if you want something changed on it. Make sure you do this so that your agent can assist you in helping you along the way, choosing a plan and everything else that is needed. So now we're going through, they're going to ask you for another security question. That's okay. And then this is the next one. Do you want help paying for coverage? Yes, this is where you're going to get Obama to help you pay for some of your health insurance and get a tax credit. And who are you applying coverage for? The whole family in this situation. Now I've gone through, because they did this last year, this is more of a renewal, and I've put in all of their information for each individual person, okay? This person, their birthday, this person, birthday, spouse, related. Go through it and add. If you need to add another person, you can click add another person. And so that's how you would do it starting out. You'd have probably the main person that you just put in there, and you're going to add wife, add daughter, add son, and daughter. As many people that are in the household moving forward, okay, and put their relationship as son or daughter or spouse and whoever it may be. Very simple. Okay. Now it's going to ask if they're male or female. And it's going through here on the left all the people that we just added them in. You have to have social security numbers for every single person. On this is blocked out, but we do have socials in there for every single person. Are they a U.S. citizen? Okay. Do they plan to file federal income taxes? Yes. Joint income taxes? Yes, for this family. And they claim their dependents, both of their daughters. And yes, they do live with their daughters. Now we have Muriel, and obviously her social is blocked out there. Is she a U.S. citizen? Yes. This is their address. And I'm just going through and making sure all this quick. Now their daughters. Once again, I need their social. It's blocked out for you guys. You can't see it, but it is in there. Every single person needs to put it in there. Oops, she is not married. It's a very simple process as you're going through this. There's just lots of questions, and that's why we did this video, so that you know you're on the right path. And why are they asking all these questions? Is this even needed? Yes, it is needed. So continue to follow through this for you as you're doing it. And I'm just clicking continue because most of the stuff is already in there. Every now and then there's not. And we have to answer some questions. Very simple. So make sure you answer all these questions correctly, every question throughout the whole thing. We don't want to have anything incorrectly done or anything like that. So now I've just went through everything to make sure that it was correct. Went to the bottom, hit save and continue. If it's not, go back and edit it. It's very simple. Now I'm into the income step number 3, and so I'm going to put in their pay stubs and W-2s and things like that. I don't actually need actual physical paperwork. I just need to have it be the same. So we put this in there, make sure everything is correct. We're going to block out all their income so you don't know how much these people make, but yes. Now for their kids, they don't have any jobs, so we just put them as no's. No alimony. But if they do have them, click yes, go through it, and make sure it's correct. Because we don't want to do anything in this incorrectly. So it's very simple. The kids don't have any income, so we just push them through. So now I put all this in there, double checking it all. So now then we're down to the 4th step. Okay, after I've done all the income. The income's a very important step. You want to make sure that you have it done in there correctly for the tax bracket that you're in, because there's different levels of poverty level to 100%, 200%, 300 to 400, 500. Above 500%, you don't qualify for any of the tax credits. You can still go through the marketplace and get one of their plans. You just don't get a credit. And some of these plans are better on the marketplace, so that's okay depending on your situation. So if you want to do that, yes, go ahead. If you don't want to, you can go through a direct plan very quickly, very easily through another company like Select Health, Humana, Arches, Blue Cross Blue Shield, and Altius. There's other companies. That's some of the main ones that we use. So in this part, if someone is eligible for one of these, then they don't actually get to be put on the plan. So I would click no on these unless they have had it or they are eligible, then they need to be on there. But in this situation, he is not, and nobody is eligible for the COBRA plans, and so it makes it easy for us to move forward. Kind of why I'm using his as an example, because he's a little bit easier to do. So if you're going to be doing it for the new 2015 year on these plans up here, I'm glad I remembered this. If any of these lost coverages, even if they are losing their coverage, still put no. That's what we got an email from the government. They want us to put this to start them in the year January 1st, 2015. So that's what you want to do there. Whoops. Got to put none of these. Nobody did any immigration. Nobody recently moved. Nobody was been in jail. I mean, yes, they asked that question. Now you sign and review it. Now I have my client here, and he's going to review all this. And agree. And then he is going to type his name in here. And submit application. So now you can see we have this here. We want to continue to enrollment eventually, but first we want to see his eligibility results. Okay? So we're going to open this results up. And we're going to see here that he gets $3,216 a year and $268 monthly. This is what they qualify for. Okay? So you can write that down, but on the next page it will already calculate that for you, which is nice. Okay, as you click here to continue to enroll. Once you get to this point, you're probably going to want to call your agent to have him help you choose a plan. This is where he wants to be able to look at this with you, go over some things if you have any questions. This is where we're going to set, let's go back here. Make sure right here that every single person's name is listed that wants to be on the insurance. If just the mom and dad are listed, your poverty level that you put in your income is between 100 and 200%. So you need to raise your income to actually have your kids be able to be on this health plan, or they are going to have to go to Medicaid. If you want them to go to Medicaid, that's fine. It's free. It's a great program. But if you don't want them on Medicaid, you need to increase your income this next year to be to a level of 200% and then put them in there. Okay? So make sure they're in there. So we're going to continue there. This gives you a little example about all of this. Okay? And right here, do you want to add this tax credit to your month? Yes, you do. That's what you're doing. $268 a month. That's great. Okay, so now we're going to go to the next step here. Answer some questions about your household. Has anyone used tobacco? This is the only health question you're allowed to be asked, if you use tobacco or not. So they don't use tobacco. Everyone's on the policy here. Once again, if your kids aren't there, then you need to change it there. And now we're going to select an insurance plan. So this is where you want to call your agent, talk to them, figure out exactly what plan works best for you. Okay? So I'm just going to kind of go through some steps here of what I think is good for somebody in any situation. Now, you have the different plans here. For this person, Platinum doesn't apply. It's a 90-10 coverage. The Gold is an 80-20 coverage, and the Silver is a 70-30. But the Silver, because she does qualify for tax credit, gives her other benefits. So I would look at Silver first for anybody who's doing it. It sometimes actually turns out to be better than the Gold. I know it's goofy, but that's how it works. If you don't qualify for one of these plans, a tax credit, then yes, the 80-20 would be normal and it'd be pretty simple there. So we're going to look at this Silver plan here first. Okay, so now it's going to list all the different plans that they actually qualify for. So here's one of the companies. Here's the deductible, the max out of pocket. It's an HMO, so this is a family deductible. You want to maybe do a PPO, so you don't have to do that. And so here's a select health value plan. It's $1,000, a $2,500 out of pocket for the group total. Co-payments, $25 copay after the deductible, $50 copay after the deductible. That would be $416. I think this would be a great plan for this person or situation. Okay, so I click compare to save it there so that I can look at it later, and I just keep going through these plans, look at it. I can click at the details and figure out exactly which is best for me. Okay. Once you like it, you can click enroll and actually go to the next page and sign up for the policy if you want. Pay for it, move forward. It's very simple, and we can move forward there, which I'll show you here in a minute. I'm going to talk more about the client, about what they want, and then help you show enrolling here in a second. Okay, so here we have decided to choose between these two plans. We were discussing between going with the $1,500 deductible or the $2,500 deductible. As you can see here, they're basically the same price, money. I mean, $519, $521. So we looked at the calculations for having a $2,500 deductible and a $1,500 deductible. Now this person, they're wondering, if I had a baby, the baby costs $7,000, which one will be cheaper for me in the end? So we did the math, and a $1,500 deductible would be cheaper because after the $1,500, you only pay 20% moving forward. Well, the $2,500, you pay 20% moving forward. So unless you hit this max out of pocket, which is a huge amount, or this $8,000, then that's where the difference between these two hitting the max out of pocket. But the client doesn't think they will hit this max out of pocket, so they're going to go with this preference gold $500 select value, $1,500 group max out of pocket $8,000. And we're going to click right here, click enroll. Very simple. See, this is going to pop up every single time. Someone under the age of 19, this doesn't include dental coverage. If they want it, they can choose it, but at this point, we don't want to do that. Their plan is going to be 521. We need to confirm that. Boom. So there we have basically enrolled the plan, which brings us back to this other page. And now you can choose a dental plan if you want. This person doesn't want a dental plan, so they were skipping that plan, coming down here, agreeing to the terms, and once again typing in his information, signing it. Thank you for signing that, sir. Going over, you can see the plan would be $789, but he gets his tax credit of $521. I understand and confirm. Starts January 1st. So right here, everything is done. You have successfully logged on. You've done everything. The difference is they need to log in and pay for this by January 1st. Okay? On January 1st, they will not let you pay. You will have to move to February 1st. So do not wait until January 1st. Do this that week of the 30th, whatever that is, so that you don't have an issue. This also happens for February. Once you hit February 1st, you cannot get February. It moves to March. So don't do that. Don't procrastinate. Do it a week before or pay for it now. If you're with the client, it makes it really easy. Click this button, click to pay for it, and you move forward. If you have any questions, please contact your agent, and he's probably the one that sent you this email. And if you have any questions, you can call Advanced Insurance at 801-226-1100. Thanks. Bye.